Hello, I'm Paul Forte, and I'm going to present for you the findings from the dementia case study. We are all aware, I think, that there is a great challenge in providing dementia services and in managing the issues to do with dementia in the population. It's an increasing issue all across the EU. Services required, complicated and complex to bring in, and there's a very strong need and emphasis for supporting informal care from family, friends in the community, as well as organised care services across health and social care. And we are taking as a starting point the idea that integrating all of these sorts of services and providing support across them are very important as a process characteristic for services. There's been little research done looking at this issue of integration and looking at the effect that has on care processes and quality. So, to some extent, the dementia case study out of all of them is a particularly innovative experiment and one which has led us on quite an interesting journey over the course of the project. First of all, let's have a look at our case study demarcation. The area in the box in the middle, the acute medical care and post-acute care, are where we actually have to start before we can find out more about what is going on in the continuing care, people in people's home or in care homes around it. So for our purposes, we try to understand who are in the acute sector, whether they've got dementia or not, and some of the reasons why they might have ended up in acute care or be effectively stuck in acute care for longer than people without dementia. We believe that what's going on around the acute hospital setting is a big contributory factor to this and will reflect the degree to which those services are integrated and coordinated. When we look at lengths of stay in the acute hospital, we can see that patients without dementia on average stay much shorter lengths of time than the overall average, including patients with dementia. This is a common feature of nearly all of our systems. The exception of the case study here is in Spain, but elsewhere this is a more normal sort of pattern. When we look at where people are discharged to, we see that in Finland the majority are discharged to other hospitals, short-term, non-acute care. In Greece, the opposite is true. The majority of people go straight home, and this varies across the different case study sites, as you can see. Moving to some data from the user survey. Here the survey, by the way, was conducted of both the patients or people who had been in hospital who had dementia and of carers. The survey here shows the levels of confusion in people with dementia who are living at home. The noticeably larger group of people with mild levels of dementia is noticeable in Finland. The average age, though, of people in Finland, because they are diagnosed on average earlier, is 77, whereas the average age in other case study sites is 82. In the Finnish case, this is due to the, as mentioned, the greater use of memory clinics and earlier diagnoses. There's also other data which shows that, in fact, in Finland, people are admitted at an earlier age to care homes as well. When we now look at the quality of life of people with dementia and the quality of life of their carers, looking first of all at those with people with dementia, we can see that the indices, the Euroqual indices, the EQ5D, are actually considerably lower than we find in other case studies. We don't have data for some of our case study sites. And if we turn to look at the quality of life indicators for the carers of people with dementia, we can see that while they're certainly higher, they do seem to follow a relatively similar pattern in scale to those with dementia. The user survey also asked about people's experience of having been in an acute care setting. Primarily these were addressed to the carer, with the person with dementia being asked to answer if that was possible. and it was generally trying to find out about whether the person's confusion or dementia was known about at the hospital and people were aware of it when they were being treated, and the extent to which people were involved in consultation about treatment, about what would be happening on discharge from the hospital setting, and whether it was really appropriate treatment considering the confusion involved. As you can see, there's a variety of different perceptions going on here, perhaps noticeably in England, scoring relatively consistently across a lot of these different sorts of issues. It's much more varied in range in our other case study sites. Some brief conclusions from the dementia case study. Bearing in mind it was innovative and a bit of an experiment as well, we found it was a very interesting study to get to grips with, primarily for trying to obtain the data, which was quite a complex issue in its own right, and the running and undertaking of the user surveys. Well, we can see from the data we have that it's a very complex care network, and from that we find that integration and coordination is pretty much essential if we're going to make best use of the services and provide higher levels of quality for people living in a home environment. Supporting the informal carers is crucial in this respect. We note that the use and the introduction of memory clinics leads to earlier diagnoses, particularly in the Finnish and the German case studies. We were also able to note that there was a considerably earlier age admission to care homes for people with dementia in the Finnish case instance. By contrast, the patients in the Greek case study, where the long-term care for them was community-based. We also noted generally that in our southern European case study sites, compared to the northern ones, there was overall a larger amount of care hours going into the support and care of people with dementia, both from formal care services and from informal support from family and friends.